This is Dr. Jamie Koufman. This is Dr. Koufman's Acid Reflux Hour. I'm sorry, I've had some technical problems. I want to discuss today sort of some of the foundational work that prompted my book, Dropping Acid, which is essentially a landmark book. Why dropping acid? So the question is, if you have acid reflux, why should you go on a low acid diet? And so there's some surprises in here that are scientific but have to be revealed and discussed at least in some manner. When I first started reading about reflux, which was 1981, I found out that when you had reflux, up came acid, hydrochloric acid, and up came an enzyme called pepsin. And when I read about pepsin, it was what's called a proteolytic enzyme. It destroys protein. It's very powerful. In fact, biochemists use pig pepsin as the first step in breaking down big proteins so they can be studied. So pepsinization is a big deal, and it's a powerful enzyme. So I was very interested in this. I thought, well, if we could identify pepsin, when someone spit pepsin, that meant they had reflux. So we immediately began looking for a pepsin assay. The first thing I found out is the police had something where they could detect vomit, but it wasn't really a pepsin detection. If you had vomit on your shoe, it might have significance in the case. But in any event, I began finding there were no real experts. I think there was a Dr. Norman who had done some work in Scotland. And so I began to read everything I could about pepsin, and it wasn't all that much. And then I ended up contacting some people in Dundee, Scotland, namely Nicky Johnston. Over the course of the next few years, and obviously there were many years between that first discovery and publication, which was, more than a decade later, we began doing actual research on pepsin. So one of the things we did is we took people who had reflux laryngitis, the symptoms and the findings in the pH studies, and we got permission to take little tiny biopsies from the back of the larynx where we do no harm to anything, vocal cords, and then we looked for pepsin, and we found pepsin in all of them, and not in control. So people who have reflux had pepsin in the tissue. And then we actually began to do we could take it and put it on a slide and examine it under the microscope. It's stained for pepsin. So we found pepsin on the surface, but to our surprise, it was in cells that was in deep, and so pepsin was in the tissue. One of the things that happened as I was going along clinically was that I found that people who drank a lot of soda pop, I drink 6 Diet Pepsis a day. I drink a gallon of seltzer a week. All the people who were drinking a lot of soda weren't doing very well. So I didn't at that time have an idea about how pepsin worked. But I did find out that pepsin had its maximum activity around pH 1, and that it was active all the way up to a little extent, almost to pH 6 or 7. But it really kicks in big time at pH 2. pH 2 is the max. So we began looking at the acidity of beverages, and to our shock, they were all very acidic. They were all in the stomach acid range. And my assistant, I kept saying, why? And my assistant found it in 1973, following an outbreak of botulism of food poisoning. The FDA made a law, a regulation, that everything crossing state lines either had to be homogenized, boiled to oblivion, and packaged, or acidified. And it recommended pH 4, less than 4. So that's when it began in 1973. But nobody ever told manufacturers, don't make it too acidic. In nature, the most acidic thing is lemon and lime, pH 2.7. But there are soda pops that are all 2.7. I don't remember, but Diet Mountain Dew is way up there, way down there, I guess, in terms of pH. Just to explain pH briefly again, pH 7 is neutral, above that is alkaline, below that's acidic, and the lower the number, the more acidic, and it's actually logarithmic. So that means pH 2 is 10 times more acidic than pH 3. So we now know that we have acid and we have pepsin, and the pepsin is in the tissue, and not only that, it embeds itself in the tissue. So the reflux is gone, the acid is gone, you drank some milk, but there's pepsin hanging around on your vocal cords, in your throat, wherever it may go, sinuses, your eustachian tube area, for ears, so on. So we began looking at the pH of foods across the board. We studied all the fruits and vegetables. If you go on my blog, jamiekoufman.com, you'll find a lot of little surprise, if you will, posts. There's one on the acidity of all the fruits and vegetables. And what we discovered in our work and further work was that in the esophagus we saw real damage at pH less than 4. And in the larynx we saw real damage at pH less than 5. So it was more sensitive. And in fact, when you get in the lungs, almost anything, any pH will cause damage and trouble. So pH 5 was the target that we wanted to reach. And so what we did is created a diet in which everything was pH 5 or above, even allowing for some acids as flavorings. For example, we discovered lemon zest gives great flavor, but doesn't have the acidity of the lemon. So we began putting together this diet, and we came up with a diet that was basically low fat, low acid. By the way, low fat, another issue. Fat makes the lower esophageal sphincter relax. Have yourself a big bunch of brie cheese or a hamburger. So we had a low acid diet. The only fruit you could have during the, if you will, we called it at the time the induction diet, but now we call it a detox diet. So the only thing you could have for fruit was melons and bananas. And even bananas, good as they are, pH 5.7, are a trigger food for a small percentage of people. And if you read the article on banana, read the article on peanut, you'll get the idea that it's usually one chemical that it causes the trigger. So everybody's different, and there's a lot of different chemicals and a lot of different stuff. Interestingly, we recommend olive oil, all you want, fish, and avocado, high fats, high good fats, and in my experience, none of them causes reflux, which is really interesting. I had one woman who was a sushi lover who said yellowfin tuna gave her reflux. And it's possible there was one chemical in that. So the whole idea of the low acid diet was not that that was everything in terms of an overall treatment program, but that it was crucial. So if you were eating early and not drinking alcohol and doing all these other things, but you were still drinking Diet Pepsi, chances were pretty good you weren't going to get well. So we started out with this diet, and with the old kind of, if you will, regulations, don't eat within 3 hours of bed, don't wear tight clothing, we put those with the diet, and a lot of people got well. The next thing we discovered was alkaline water. A colleague in New Orleans called me and said, I got some people who said when they drink alkaline water, which is indigenous there, pH 8.8, their heartburn goes away. So the Evermore company gave us a grant to study. We went in the laboratory and studied it, and we found that pepsin died at around pH 8. So pepsin is alive and active, really, really churning, pH 2, pH 3, everything in a bottle or can. It doesn't matter. Energy drinks, fruit drinks, all acid added. And a lot of the time they don't tell you the truth. It's just this all organic, and then the acid added is enhanced with vitamin C, ascorbic acid. By the way, in Coca-Cola it's phosphoric acid, which if you go into a hardware store is rust remover. So the low acid diet came about as part of a program. The low acid diet was enhanced by alkaline water, by milk. We found I drank almond milk, unsweetened, and pH 7.4. So we began this idea of a low acid diet very strictly for a period of time. We call it detox 4 weeks. But we include with that no eating within 7 hours. It's a reverse intermittent fast. sleep in a high incline, that's gravity. Use of famotidine before breakfast or dinner, double dose before bed. Alkaline water spray, and gum chewing. There are articles about every one of those things. When you use my blog, first of all, sign up for the blog. And each week you'll just get an email with the topic. And if it interests you, you'll save it or open it. And if it doesn't, delete it. But there's an article on every one of those. There's an article on gum chewing. It's an article on, articles on pepsin. Article on alkaline water and pepsin and why the spray is important. So all of these things are part and parcel of a low-acid diet. But the point that I'm trying to make is if you do all of those things and you have a high-acid diet, you will fail. So a low-acid diet is a prerequisite. Now, the question is, how long? I would say, if you're a big-time... And by the way, there's another problem here. The refluxes don't come in one size and shape, right? If you're just clearing your throat, it's not a big deal, and it's not interfering with your work, and you have thick mucus, and that's your main symptom. You probably are not in the same ballpark as someone who is actually having true shortness of breath, can't get up a flight of stairs, can't take a full breath in. You're not in the same group of people who's having precancerous changes, but it's not a smoker. So there are levels of severity and of concern about people. That said, if you want to stop your reflux, the only way you can stop it, the only way you can cure it, is to stop it for at least 1 month, completely, 100%. And that's why the detox program, if you go on my blog and just put reflux detox up, it'll come. And all the articles written this year are relevant. Which brings me to another point that I was going to, non-linear thinker. This whole question of not enough acid, it's entirely made up. There's not a shred of evidence anywhere. Okay? If you want to ask a question, okay, go to PubMed. Okay, that's where peer-reviewed articles in every field are published. Okay, if you put hypochlorhydria, low acid, and aging, and the elderly, or anything, there's not a shred of evidence. I had a woman who was 99 who was refluxing like a bandit, and her pH test showed acid at pH 2 just like everybody else. So everybody has acidic acid, everybody has enough acid, and this whole idea of low acid, there's a small couple of groups, for example, pernicious anemia, which you can look up. It's autoimmune disease. The stomach becomes atrophic, B12 deficiency, a lot of other symptoms and problems. 1 per 4,000 is the best you're going to see for pernicious anemia. So this whole idea of, I don't have enough acid, and you start taking hydrochloric acid and enzymes and all these things, they're actually making your reflux worse. There's not a shred of evidence, let me say it again, not a shred of evidence that low acid is a significant clinical problem anywhere, even though the Mayo Clinic has a little article on it. Because what happens is the internet makes it grow. Everybody says, so then there's a case, and then someone picks it up, then someone writes a story for some magazine, and that gets picked up. And then when whoever it is that writes the article for the big university gets around to it, they find all this stuff, and they go, but they don't go to PubMed and look for scientific data. So there's no such thing as not enough acid. When you put the pH probe down, everyone has acid. Everyone has acid pH 2-ish, and it's a non-issue. I'm the only one who's done reflux testing in 10,000 patients using state-of-the-art technology, having real acid measuring chips in the stomach, in the esophagus, in the throat. So understand that low acid is not a deal, and so what we do want for a diet is a low acid diet. Pepsin gets washed out in about 3 weeks, and if you have it on your vocal cords, when you drink alkaline water, you don't get any on the vocal cords, the throat clamps shut, and your vocal cords especially, so you don't aspirate. But if you're a singer or an actor on Broadway, I have these little spray bottles. Read the last article I've written on alkaline water. And you can put your alkaline water in it, just pH 9.5 alkaline water. And spray your vocal cords. The only way you can directly wash out pepsin. And turns out that a lot of singers on Broadway are carrying around these little blue bottles, many more than I ever saw as patients, so it's sort of a thing. So in summary, a low-acid diet's a good idea. I would argue that you ought to limit assuming your reflux is fixed, you're not having symptoms, you're not having throat clearing, you're not having cough, you're not having heartburn, you're not having any of the symptoms, you're not having sinus problems or ear popping and fullness, and all of these symptoms go away. Does that mean you can never have lemon? Yeah, you can have lemon. But then you have to look at the whole concept of pH balancing. And I've written a blog recently, a post on pH balancing. Yeah, you have the salad with the balsamic vinaigrette and a little lemon and olive oil, and you drink an alkaline water. pH 9.5 is a chaser. And so there are a lot of ways that you can, if you will, get away with more acidic stuff, but it shouldn't be a lot of acidic stuff. So should you ever go back to drinking 6 Diet Cokes a day? Never. Okay. Should you make seltzer the only thing you drink day in, day out? You walk around with a machine? Never. Okay. If you have reflux, that ship sailed. So let's see how we are on time. I really don't have anything more to say about it. I can't recall honestly if I've written an article about why a low acid diet, but certainly the first 45 pages of Dropping Acid, the Reflux Diet Cookbook and Cure, they are where the science is embedded. And so if you want to understand acid and pepsin, that's where it's best provided for you. So on to questions. I'm surprised by some of the questions and delighted by some of the questions. So I want you to know that this first question is going to be my blog for next week. Do dry mouth and dry eye, are they related to acid reflux? And the answer is they are. It's again sort of tricky. Saliva is really important. Saliva contains bicarbonate. Bicarbonate neutralizes acid. So let's say you don't have significant reflux disease. Even so, almost everybody will have some reflux into the esophagus, a few events after eating a meal, a bigger meal perhaps. What happens though is though the pH in the esophagus is, let's say, 2, each time you swallow, a little saliva comes down, and now it's first swallow 2.5, second swallow 3. So it takes 5 minutes to get the right amount of saliva and swallows to get the pH back to neutral, to 7. And so that's called esophageal acid clearance. It's a fancy medical term for saliva is really important to restore normal pH in the esophagus after a reflux event. There are a lot of things that cause dry mouth and dry eye, and the question was about does dry eye, but usually people who have dry eye also have dry mouth. Now if you're at night and your mouth really feels dry, you probably have either an array of drugs that cause, and the word is xerostomia, not enough saliva. It sounds with an X, xerostomia. You either have that from medicines, or you have something called Sjogren's, and believe me, that's a whopper. S-J-O with an umlaut, R-G-R-E-N-S. And Sjogren's is an autoimmune disease, and it attacks salivary glands and tears. And so dry eye, you have dry eye, you should be checked for dry mouth. And there's a test that can be done where they put a little tiny strip in your eye and they wait 5 minutes and you should soak the whole strip. And if not, you have a dry eye. Now, another study was done in which they took a people who had radiation, who didn't have problems with reflux, but had some reason to have radiation. And after that, 100% of them had reflux. And the reason is that they dry up the salivary glands. So people who have xerostomia because of radiation, because of Sjogren's syndrome, because of medications, every one of you must be on top of reflux in an ongoing reflux program. And so you should know. And I don't really know whether people get drier just with aging, but it doesn't appear to be the case. So the answer to the question is dry eye and reflux are related if you include dry mouth or xerostomia. This question I think I've answered. Clark, when people talk about low acid, does that refer to low pH or not enough acid? The answer is bullshit and bullshit. There's plenty of acid, and the pH is plenty low. Whoever made this up was trying to sell something. It's all about money. There's so much. There's like 1,000 articles on low acid. Not a shred of evidence that it's a problem. Could you talk about the cure for thick mucus? How do you get rid of it? So, as many of you know, I've changed the term. I came up with the term LPR, laryngopharyngeal reflux, in the 80s because my people had reflux in the larynx and throat, laryngopharynx, and I didn't want to say GERD, which is what the GIs were saying for people with esophageal disease, heartburn, and indigestion, and so the term LPR came about. But now, how many years later, right? I've seen people with sinus problems, a lot of them. I've seen people with ear problems, certainly a whole lot of people with respiratory problems, people with shortness of breath. So the term laryngopharyngeal reflux was not only hard to pronounce, difficult to understand, but it was not inclusive enough. So the new term is respiratory reflux. I recommend that the term GERD be banned because it looks like it belongs to the gastroenterologist. It's the generic term. They take care of esophageal reflux. We take care of respiratory reflux. Okay? GI, respiratory. Okay? The GIs know nothing about respiratory reflux. They do know about my work, and they've done their very, very best to ignore it. Because if I'm right, the GI model basically falls apart. So if you have respiratory reflux, you should go to an otolaryngologist, an ENT, and not a GI, at least first. So the question was, how to cure for thick mucus? The lining of the respiratory system are mucous membranes. And what do? They make mucus. And what do when irritated? They make more mucus. So thick mucus is reflux. Okay, thin mucus, allergy. Allergies never bother your vocal cord. Never allergy. Okay, just isn't. So if you have thick mucus, you have reflux. What kind of reflux do you have? Silent nighttime respiratory reflux. So look at what time you're eating, look at what you're eating, look at the whole question about what are my risk factors for reflux, and the answer is there's no medicine. The only thing that might help a little bit is staying hydrated well. But, the drier you are, the thicker the stuff. But for all intents and purposes, and by the way, chronic throat clearing and mucus, sometimes they look like the tip of an iceberg. I remember a patient coming to me with too much mucus, and when I examined him, he had terrible Barrett's esophagus. He had terrible snoring and sleep apnea, and so the tip of the iceberg was too much mucus. So too much mucus, in my opinion, is almost always due to reflux, respiratory reflux. I don't know the question, but I'm going to answer it anyway. Will the puffer help the breathing while on the detox diet? Some people get some benefit from albuterol, but you don't have asthma if you don't, unless you have prolonged expiratory, can't get the air out of your lung. It's not asthma. So any kind of trouble breathing in, shortness of breath, air obstruction, can't take a full breath on inspiration, all of those things are reflux caused. Now, for some people, the albuterol inhaler can be of some use at the beginning, no problem. You can use it all you want. But that said, stay away from all the other asthma treatments, the Symbicort and all the other stuff. Unless you have asthma, you shouldn't be on asthma treatment. And by the way, you should know that 80% of the people in America with asthma don't have it. How do I know that? Because I've looked at thousands of people over a period of 50 years, and every single time I've had a patient with asthma, I've said, when you have an asthma attack, do you have more trouble breathing in or out? And they go, in. I never had an asthma attack. Well, what's your asthma like? Well, it's hard for me to take a deep breath in. I'm not asthma. So, the puffer, yeah, at the beginning, but you need to get your reflux fixed. Alex, your question makes me a little irritated. Just started your program. Can I manage H2 blockers and Gaviscon aniseed and avoid the PPIs? Mild intestinal metaplasia. First of all, mild intestinal metaplasia everybody has. You don't have Barrett's. It's called the Z line, where the esophagus and the stomach meat that's called the Z line. Normally it should be absolutely circular, but almost everybody has some irregularity of that. It's of no clinical significance. So when I do the report on T&E, it's basically a regular Z line. So it's of no consequence for most people, number one. Number two, proton pump inhibitors, if you want to know people who have Barrett's, long-term use of proton pump inhibitors are associated with increased risk of esophageal cancer. Duh. It stops the symptom, whatever it is, maybe some heartburn or something, but the disease goes on unabated. Maybe you can drink more when you're taking your Nexium. So proton pump inhibitors I never use for anything. They don't cure anyone, and I think they should be taken off the market because of the side effect profile. I've written 4 articles on PPIs on my blog. So, no PPIs for you. Look at the whole program. Read. Part of the problem is a lot of people don't like to read anymore, and I'm putting it on. The reason why it's on a blog is because I write the blogs for people who do consults. So if someone has a problem with an inlet patch, which is not a common problem. I read an article on inlet patch. You can type in inlet patch and up it'll pop. So the truth of the matter is that what's up there is my last book, which will be called Respiratory Reflux, How Silent Reflux Causes Diseases. And it's a paradigm shift. It says that GIs don't know anything about reflux. That's why the rest of your doctors don't have it in their curriculum. And yet, almost all of our respiratory diseases are reflux-related to some degree. So, I'm out of time. I just want to answer the last question. Is it okay to sip water or tea after I take Gaviscon? Yeah, the Gaviscon will rise to the top. You can drink afterwards. You can drink before. I recommend Gaviscon Advance after meals and before bed. So I'm sorry that I was a little late coming on today, and I'll be on next month on the first Wednesday. Thank you very much.